I'm Joe D'Ambrosio, and I'm the Director of Behavioral Health at the Traeger Institute. We're located on Market Street, and I'll tell you a little bit more about the Traeger Institute in a little bit. One of the things that I do is behavioral health, so I meet with patients on a weekly basis, and over the last 10 years, I've worked with a lot of patients with movement disorders, and we've used mindfulness to help them. So I think that's why I was asked to speak today, so it's an honor to be with you, and happy to be here. A little bit about me. I moved here in 1977 for a one-year stay. I was working for GE when GE had 14,000 employees at that time in 1977. And I came for my one-year stay and didn't want to go back to New York. I had left the city. I grew up on the Lower East Side of Manhattan, so I was so happy to be here. I thought I had landed in heaven. And they kept wanting to transfer me back east. And then from back east, they gave me a couple of transfers to New Mexico, and I go, no, I definitely don't want to go there. So I ended up leaving and not knowing what I wanted to do. I went to law school, and I actually practiced law for 25 years. Wow. And realized that, I don't know if you know the campus real well, but the law school's over here, and the Kent School of Social Work was literally right next door. And I was always supposed to be a counselor, but not a law counselor. I never really did enjoy what I was doing as a lawyer, and I went over to the Kent School, and back when I was 50, became a social worker, went on for my PhD, and focused in on clinical work, which is what I should have been doing all of my life. But luckily I got there, so I was happy about getting there. And I didn't have to go back east, which was good. So that's how I'm here. So, and I've been in this field in behavioral health now for close to 15 years that I've been working on, working with people that have all sorts of disorders. So we have, just general life. We do counseling, marriage counseling, couple counseling. We see people with a lot of depression and anxiety. And you could imagine from the pandemic, we have a lot of people with anxiety and depression and social isolation. I'll tell you about the Traeger Institute later, but we do focus in on older adults. And that, interesting, when we started, it was 65 and above, then it went down to 60 and above, then it went down to 55 and above. It's now down to 50 and above. So we're considering anybody 50 and above older.
Interesting.
So I'm here to talk about mindfulness. And mindfulness, some people, when they hear the word, they think it's like a magic thing that you do. But all of you have practiced mindfulness in one way or another over your lives. The difference is when you make it a practice, you become better at it. So mindfulness itself has its roots in many different religions, a lot of the Eastern religions, but it also has its roots in a lot of the Christian religions. When I first started teaching mindfulness to the students, a lot of the students said that their Christian background said they couldn't participate because it was like voodoo or something bad. But it really is not. It's not about a religion. It's about training the mind to approach life differently. For example, when I was driving over, I actually stopped home real quick. I just live over in Heights Point, so it was real close for me. But when I was driving over, rather than turning the radio on, I was listening to the wheels rolling on the road. That was my mindful moment, preparing to come and hopefully do a good job and express myself appropriately to all of you. So it's that little moment of time. So it involves being in the present moment, and it involves really taking that time, deliberate and intentional time, to practice nothingness. And that sounds like insanity in many ways, but it really is freeing your mind of the daily chores. And for today's presentation, it's a short presentation because I do want to practice a little bit with you. What I wanted to do was just give you a highlight. So this is a big overview of what mindfulness is. And then if anybody's interested, we can always go deeper. We can always go deeper in another session. We found, and the research has found, that mindfulness really works. So John Kabat-Zinn has been doing, I'm sure you've heard of mindfulness-based stress reduction. Has anybody heard about this? Yeah, it's a program they have in hospitals around the globe where people actually practice mindfulness-based stress reduction. And it's a practice of actually looking at each area of the body and relaxing the body. So I learned mindfulness-based stress reduction probably about 20 years ago at the Earth and Spirit Center. Do you know about the Earth and Spirit Center on, where is it? On Trevelyan. Trevelyan, is that Trevelyan? No, Trevelyan, Newburgh Road, off to, yeah. Trevelyan, yeah, off of Newburgh Road. And I learned it there. Really, my practice was not that great at the time, but I found something. I was really suffering from a lot of pain, shoulder pain and neck pain. I think it's from being on the computer all the time, also aging. And the mindfulness-based stress reduction was able to help me relieve some of that pain. And I'll explain how in a minute. But I want to tell you a funny story about when I went for my mindfulness-based stress reduction. So I brought my boss, who's from South Africa. She's type A. She's a workaholic. She's brilliant, probably the most brilliant person that I know. So I drove from the office there, and I said, Anna, you need to leave your phone in the car. She said, no, I can't leave the phone in the car. I go, no, we're going for like a mindfulness training. You need to leave the phone in the car. She goes, I can't leave the phone in the car. So we get into the training. We're all in a big circle, and we're on a floor with our legs on little cushions. And the training goes on, and the instructor, he says, starts doing all the training, get in touch with your feelings, and I want everybody to relax. And then after about 10 minutes, everybody was very relaxed. Her cell phone went off with the Alleluia chorus. And I was sitting there, I was cracking up laughing, and she couldn't find the phone. She was reaching in her bag. And she's someone who she doesn't believe in mindfulness. She says, well, I'm mindful when I cook. That's one way of being mindful, but really it's a practice that I really want to get you to think about today. It's actually doing that practice. She didn't last the whole training. That was like 10 trainings. She didn't last. She didn't come back with me after that. So let me ask you a question. Does the mind control the brain, or does the brain control the mind? What do you think?
Mind controls the brain.
Mind controls the brain. What you think, we know from research, what you think in your mind controls your body, the brain. So you've seen stories over a lifetime of those Hindu monks walking across the hot coals and everything. It's all mind control. So they can sit for 3 hours and their legs don't hurt, nothing bothers them, they're able to get over it. I sit for a half hour, my knees are aching me, I'm thinking of what I'm going to eat for dinner, all sorts of things going through my head. So the mind is what we're trying to train. And I wish I could have learned this when I was a kid. I wish when I was younger, to be able to learn this, to be able to control life with my mind. So whether you get irritated if someone cuts you off in the car, you have choices that you make. That's your mind, choosing whether you're going to get upset or not, right? We all do it. We all act automatically a lot of times too when we do those things. So what this is talking about is making the connection between what's up here and then the rest of your body. Being able to control the body with the mind. That connection that you make really attends to both the physical and emotional side of yourself. It's not just one-sided. That's how much power the mind has over your body. But the key is that a lot of times life happens. So when you have pain or when you have movements, the movements may happen, but it's how you're responding to the movements. That's what gives you the feelings of less stress and less anxiety from what you're going through. We have automatic thoughts. There's things that we do. You automatically do them, and this is being more aware of what you're doing. So when you're drinking your drink, being able to really be aware of drinking that drink, or cooking, or walking, or doing anything, being aware of it. And how much time do we, I feel like I've lost, I'm 70 years old, and I've probably spent 60 of my years not being attached. I don't know what the heck I did. I don't know how I got through it. because I wasn't aware of what I was doing, but when I was aware of it, everything became better, and it was, even the bad things were not as bad as I thought they were. Does that resonate with anybody? Being aware of where you are. So movement disorders really present another challenge to us, because a lot of it is physical condition, a lot of it is neurological condition, and we know that you know, your mind a lot of times is not going to be able to control a movement disorder, but what it could do is give you the peace of mind when your movement occurs, to be able to accept it more. I work with a lot of patients with psychological non-epileptic seizures, and they're typically young, they're typically trauma victims, and they've learned, their bodies have learned to react to certain ways from the trauma that they've received. And we've been very successful in our program. We actually have a neurologist, Dr. Schaefer, who works with us. He comes into our clinic, and we've been very successful in really stopping or limiting the movement disorders for these people who have psychological non-epileptic seizures. So they come in, and they come in from all over. I get calls from Tennessee and all over to work with us in our program to help them. They're able, because it's a psychological non-epileptic seizure, they're able to actually stop the seizure. But in many neurological disorders, you can't stop the seizure, but it's how you respond to the seizure is what matters. Any questions? So we're looking for calmness, and we're looking for relaxation. I think that's one of the big focus that we have, is really trying to remain that calm and nurture yourself while a seizure or a movement is occurring. We can't change our physicalness. We can make modifications. We can't change it. We can change the way we respond to it. And I think that that's probably the big takeaway for a mindfulness practice, is why would you even engage in this, is to say, okay, could it help movement disorders? Yes, it could. But if it doesn't help, could it help you mentally? And that's really the big takeaway of a mindfulness practice. So we know that movement disorders lead to anxiety and depression. And a lot of the patients that I work with, they have really generalized anxiety disorder and depression. And working with mindfulness helps them accept where they are and then move on. But it also addresses the interactions that they have with their family and friends. So when family and friends are reacting to whatever's going on with them, because a lot of times that creates a lot of stress for my patients, the way the families respond, they're able to not react the way they normally would react. So an example, a lot of people in general, well, you see them on the road all the time. They go from 0 to 100. But I go from 0 to 10. Like, someone cuts me off, I'm at a point now, who cut? I don't care. Someone cut me off today. When I pull out of my subdivision, I have to take a left on Taylorsville Road. And if someone's going to the right, I don't know why, they pulled their car right here, so I can't see on the right. So I can't go. So someone today did this, that's just a little while ago, and I was thinking about that. They pulled up to the right, and I was like, maybe they're in a rush. The old me would have been angry. Now I'm like, whatever. It doesn't matter. So that's that practice of being okay with where you are. So regular practice does enhance resilience, there's no doubt about it. There's a lot of research on this, on mindfulness. It's really big right now for PhDs to do studies on. So they found that it does increase resilience, positivity, decreases negativity, and does improve overall quality of life. The key is, it's a practice. It's not something that you just do for 10 minutes and then you're done. Unless you're, I guess, really special that you could have that happen. But it doesn't happen to me. If I don't practice, I feel it. I know when I have to, I know when I'm going into a big meeting or something like that, I do my mindfulness practice to alleviate the stress and tension that I have inside of me. You won't do any practices here, any mindfulness before meetings or anything? No?
We
No?
do, my wife and I, there was a lady that does meditation and, hypnosis.
Yeah.
And, for a long time, she was coming by our house and doing it.
Yeah.
Since COVID, we've been doing it by Zoom, but, I think she's very helpful. But one thing how does one know, or do they know the type of person that they are, whether they stay stressed out all the time, or they're relaxed, or, a person that this would help more than other people?
Sure. So I've seen it really help all people, but there are some people, my boss is a prime example. She's type A, she's brilliant, she's constantly on the go. And for her to sit down and just be mindful, just stopping for a moment, it's really difficult for her to do. She will someday, as she gets older. She's 10 years younger than me. As she gets older, she will do it. I think as we age, you let go of some of the stuff around you, and you begin to say, this is all not worth it. And I think health changes us. So health changes, our general health changes us. Yes?
You asked if we had done it. I'm not actively practicing it now, but I used audio tapes 20 years ago when I had a very aggressive form of breast cancer, and for meditation every day, and it was very, very helpful.
Yeah. You know, it's interesting you bring that up too, because there's some studies that mindfulness changes cellular structure, but they can't determine from the studies if it's a direct causation.
Yeah, but it's
a hypothesis.
Yeah, but it, like you say, it helps in how you deal with whatever challenges you're dealing with.
Yes.
And the lady's voice was so soothing.
Yes.
And I often did it during the day, but then I would do it as I went to sleep.
Sure. Absolutely, yes.
And I never failed to go to sleep by the end of it.
Yeah, but it's great, and I think I agree with you, that some people, it's gonna be very difficult for them to do. There's no doubt about it. That type A personality where they can't sit down, they're constantly moving, they can't just focus in. And and we'll talk about this now, there's no right way to do this. There's definitely could be a wrong way in that, if you're moving around and you're not paying attention to what you're doing, you're not focusing in on one thing, that may be a wrong way, but there's no perfectly right way. Thoughts go through your mind no matter what. I've meditated with monks, I've meditated with Buddhist monks, I've meditated with Christian monks, I've meditated all around, and they all say the same thing. It's a practice, and it's not a spot that you get to. It's a practice that you just practice. You keep practicing over and over again. So I mentioned to you that, and you're going to have in your hand that this talks a little bit about the way you can do a practice. And we'll do a short practice before we end today. But this is a good way, just step by step, mindful breathing. You find a quiet and comfortable spot, or you lie down. I don't like lying down because I fall asleep. I'm like one of those people. I'm lucky because I can fall asleep. You could lay me down right here, I'll be asleep in 5 minutes. My wife always gets so mad at me because she says, how do you do it? How do you just fall asleep? I've always been like that since I was a kid. And so I sit up when I do it and just relax the mind. But I have a practice. Every morning I get up and I light a candle and I sit on my little cushion and I just let my mind go. I get at 5:30 in the morning. I do from 5:30 to 6 every morning. And everybody says, you're crazy. I'm not. If I don't do that, I find myself stressed out during the day. And, and I meet with patients during the day, so it's stressful, my day. And that centers me. And then at night, I'm like, woof, I made it through another day. And I give thanks for everything. And I'll tell you a little bit about my practice. But this, bring your attention to your breathing. I focus in on the breathing. Now mindfulness there's so many courses online, and people do a lot of guided meditation, like you were saying, where you listen to a voice, and the voice takes you through either mindfulness-based stress reduction, takes you through your body. So it'll say, get into a comfortable position. If possible, close your eyes. And close your eyes. You gotta be careful not to fall asleep. So if you close your eyes and you're falling asleep, just open them a little, and you can close them again. And then it'll go down each part of your body. So feel the top of your head, and then you move down to your ears and relax your ears, and relax your neck, then relax your shoulders. It goes straight through your body and then back up through your body. That's the mindfulness-based stress reduction. And they've done empirical research on that, where they've randomized control groups. They've done it, and they've shown that people who have done this mindfulness activity actually improve their depression and anxiety scores and pain scores. Because a lot of times, you live with chronic pain, you're not going to get rid of it because of medical reasons, because of physical reasons. So when the mind starts to wander, which my mind always wanders, there's no doubt about it. So in the morning, even at 5:30 in the morning when I'm half asleep, my mind is wandering to, will I make oatmeal? Or will I make this? My mind goes to food. I'm Italian by heritage, so I was thinking food. So first thing I think about, what am I gonna have for breakfast? And then just let it go, oatmeal, let it go, and then I just focus in on the breath, in and out, for me. That's the easiest way for me to do it. Now, our friends that like guided meditation, there are apps that you can download that are free. One is called Insight Timer. Insight Timer. It's a great app. And there's another one called Calm, just C-A-L-M. And you can download them on your phone. And they have guided meditations. And the guided meditation can take you, they could say, think about a time, close your eyes, get comfortable where you're seated, and think about a time when you're at peace. Pick a place where it's beautiful, where you think, it could be a beach, it could be a country, it could be anywhere, but think about it and then just relax in that space. And that's another way to do a meditation. Start with 5 minutes, see if you can go to 10, and then increase if you can. I know with what I find with my patients with movement disorders, that 10 minutes seems to be good, that they could get through the 10 minutes. But as they practice it, even when movements occur, to become mindful at that moment in time and not become a real alert or hyper from it, but just to be accepting of it. Yes?
You meditate for 30 minutes. How do you know when the time's up?
So I normally, I cheat a little bit. A lot of times I'll ask Alexa, I'll just say, Alexa, play meditation music in 30 minutes, and then the music will come on really low. Or sometimes I'll just not, most times I do that, but sometimes I'll just sit there for around 30 minutes. I kind of know 30 minutes now. Yeah.
You set an alarm on your phone?
Yeah, you could set an alarm on the phone. You could set an alarm on the phone. Yeah, absolutely you could.
I don't think your alarm is. Moon center work, you just did it.
You could. This is true. Yeah. So with Insight Timer as an example, let me shoot. Insight Timer has a timer. That's what it is. It's a timer, and it's a little app. Like it starts with when we plant trees, we plant the seeds of peace and seeds of hope. And then it has different options: timer, sleep, breath, new courses. They have loads of courses. I have a 25-year-old daughter, who actually has a course on here. And then I hit timer. So this is set for 15 minutes. That was during the day yesterday when I felt like I needed a break. And then I have it set on the bell. So what'll happen is I'll start it. Let me see if I can. It says, how am I feeling? I'm feeling okay. And then complete my check-in. And then it'll just give it a bell. And then 30 minutes, well in this case 15 minutes later, it'll ring the bells 3 times again so I know the time is over. So this is free. This is a good app that I use all the time. So and sometimes I'll stay longer, depending if I have time, I'll stay longer. I sometimes go, I have a friend, I was teaching a family therapy course at U of L. This is about 12 years ago, 13 years ago. I was teaching a family therapy course, and when I teach, you have the podium and they have the screen, and I was going through the roster, and all the students were in, and I saw this one name, Phuc Bui, and I looked at it, I said, is Phuc here? And no, and all of a sudden, this little monk walks in. This is a true story. Little robe and everything, he walks in. He bowed to me, I bowed to him, introduced himself. He took the course over the semester. And then at the end of the semester, he said, Dr. Joe, you come to my temple. So he has a Buddhist temple in the east end of town. So I'll go and meditate with him. Those guys can go 3 hours. They're like, they can, because he's been doing it since he was 9 years old. And as I said, after a half hour, my knees started hurting. But I've been to meditation practice at that temple where I've seen, women in their 80s who I can't do what they do. Right? It's mostly women. The day I was there, they were doing some bowing ceremony. And I was just in the back, off the side, and watching them get up and kneel and stand. And I was like, well, how are they doing this beyond me? So it's a practice. Once again, as they practice, they get better and better. So there's a lot of things that you could do. Taking a mindful break, just taking a mindful break during the day. So if you're sitting having coffee or, just taking a break for a moment and just breathe and follow your breath in and out. Just a little bit, just for a little bit. Practicing. The practice itself is good if you're sitting, but it's really important bringing it into your daily life on a day-to-day basis, on an hour-to-hour basis. That's if you could do that. That's really helpful. I know that it helps me with all the meetings that I go to. And then there are different types of meditations that you can do. I've been talking about the breath. We talked about the guided meditation. There's loving kindness meditation. If you're Christian and you want to meditate on just the thoughts of Jesus Christ, you could do that. Catholics meditate for their prayers. There's all sorts of, I don't know if you all have been to Gethsemane here in Bardstown. Has anybody been there? Yeah, so you can go meditate with the monks, the Trappist monks. If you haven't gone, it's really a beautiful place to go to see this in action, what they do when they read the Psalms.
You can stay there.
Yeah, you could stay there too. Yeah. Very, it's a nice weekend away, actually. And the food's actually pretty good too for the weekend. I spent a number of weekends there. But as I say, it's a practice. This 5 to 10 minutes would do it. It would help you during the week. You'll see different. You'll feel different about it. What about just in being mindful in active listening when you're talking to people and not thinking about the next thing that's going to happen? We're always forward. We're always going like forward. We never just stay in the moment. So trying to stay in the moment and actually listening when you're talking to people is a mindful moment. That's a type of meditation itself. I laugh because I always think of my wife when she does the laundry. So she's like the queen of the laundry room. I'm not allowed to do the laundry. She says I do a terrible job. So when she does the laundry, it's like a meditation. She just does it, like everything's piled up nice. She just hears. Everything's like orderly. And everyone's like, thank you, like it's great. But it's mindful for her. That's her mindful time that she has. It sounds simple, just doing the laundry, but for her, that's her time when she could really be quiet and just do what she does. So being more conscious of what you're doing. Cooking is another example. Cooking and actually being mindful. I don't know if you've heard of Thich Nhat Hanh. He's a Buddhist monk, famous, and he does the walking meditation.
I was gonna ask about that.
Yeah, which is very good, where you're actually focusing in on where you're walking and just feeling your feet hit the floor. And taking one step at a time. We're always, as I said, I feel like I missed 60 years of my life just busy doing other things. So worried about the next step and not really staying in the present moment. Think about, for those of you that raise kids, what happened there? That went fast. It's just everything goes so quickly. And we miss the moments that we're in, but we don't have people telling us these things when we're kids. Where instead, I have some patients that I work with that the kids are experiencing severe anxiety, and I go, well, what do you do on Friday night? Well, we go to Chuck E. Cheese on Friday night. What do you do on Saturday? Well, they have soccer in the morning, then they have basketball in the afternoon. And I'm like, okay, how are you going to live life like that? That's the way we live. That's the way we live as a society. We're always moving to the next step. And then general tips, transitioning between activities. So even when you transition out of this room, being mindful about transitioning out of the room. Don't just walk out and go to the car or go to the next thing. Being mindful of that walk. Being mindful of what you're doing and where you're going. Any of this making sense? Mm-hmm. It's simple. That's why I said this is a really simple presentation because it's simple and difficult in itself. It's simple yet very, very difficult to do, to carry out.
What way would you say this will help somebody with Parkinson's?
So with somebody with Parkinson's, it's just like with other movement disorders too. It's that acceptance of self and being aware when movements occur to be able to calm your mind down. To be able to calm the mind down and not be overcome by the movement. So it's actually having that breath, taking that breath, and being able to be in the present moment. This is where life has led you. This is where life is happening at this moment in time. So just being able to accept where you are. And I think that's the big takeaway of this, is being able to accept where you are, being mindful of it.
It will help you remember also, because one thing that I always try to try to give a tip for. Oh, yeah. I'm Eric, by the way.
Hi, Eric. That's okay.
Of NPI. And so what I usually introduce to everybody, especially once they start having a little bit of shuffling or a little bit more trouble walking, is to concentrate on the knees, whether it's getting the knees high marching or whether it's kicking like you're trying to knee something.
So really being mindful at that moment in time.
Because a lot of times you're not going to remember that in the moment that when you're shuffling or that you're frozen or things like that. But if you can train your mind into this, it will help you kind of remember, what you should do next.
Yes, that totally makes sense. And that's actually, with the patients that I work with psychological non-epileptic seizures, I'm actually in session able to watch them move their right arm, and then me be able to tell them, let's move that motion to your left arm, and their left arm will start going. And now let's take it to your right leg, and their right leg will start going. Now, these are different than Parkinson's, because it's psychological non-epileptic seizures. But it's interesting to watch it, and then eventually it goes away for them. But I think you're right. I think it's being able to focus in on that moment in time. Focus in on what's happening. Mm-hmm. Why is it happening? Why is what's happening, and just experiencing it. Being able to experience it. Does that answer your question? A little bit anyway? Yeah, I wish there was like a direct answer to say, well, if you do this, this is gonna happen. That's not gonna happen, probably. But you becoming accepting of where you are and being able to focus in on what's happening to you makes you present to yourself. You know, the one thing that I've learned from meditation, I think, is being present to the moment. It's interesting, just a couple of weeks ago, one of those famous Buddhist monks, and I can never say their name, he died. And he was meditating while he died. And they had pictures of him, it was all on the internet. He died in like meditative form, sitting, and they let him sit there for 3 days. He didn't make a noise, and his body didn't deteriorate. So it's one of those anomalies in life that he was preparing for death. He was just so present to the moment. So it's being present to the moment, I think, is one of the big takeaways. So, physical exercise, and I want to talk about that, about the Traeger Institute. We have Tai Chi. I don't know if Fraser's doing Tai Chi.
Mm-hmm.
We have Tai Chi that's almost free. It's like, they may charge $4, $5, but we have Tai Chi both at the Traeger Institute or online on a weekly basis. And a lot of our patients are coming to that to do Tai Chi, and they're finding it very helpful. And we have one patient with Parkinson's that's doing it. And but we have some with movement disorders. So that's available to you. We also have yoga that's both in person and online, and at the Traeger Institute. And it's easy, it's accessible, so something that you may want to consider. Some of the things that are helpful, journaling about your experience. I don't know if any of you journal, but journaling is really helpful from a mind standpoint to clear your mind, get everything out of it. Your breathing exercises, we talked about it. There are specific breathing exercises that you could practice. Healthy eating, of course. I'm trained in lifestyle medicine, so I'm board certified in lifestyle medicine. So I always promote with all of my patients that I work with healthy eating. And there's a direct connection between what you eat and the mind. Direct connection, especially with anxiety and depression. So there's articles that are written on that. Mindfulness-based movement practices such as Tai Chi is one of them, and then consistent sleep schedule is getting that 7 hours of sleep a night. And that's something that we all need to work on, is making sure that we're getting at least 7 hours of sleep. They said that it used to be between 7 and 8, now they're saying that 7 is the magic number that you want to try and get to for sleep. So the Traeger Institute is, do you all remember the Dulworth Furniture Building, those that live in Louisville, it's downtown? Anybody ring a bell, anybody? The Dulworth Furniture Building was on Market Street, and the ironies of life, I actually bought my first law desk there from Mr. Dulworth for $300, and I argued with him, he wanted $500, and I paid $300 for it. And ironically, as life goes, life was full circle for me. I was working for U of L, and then they started this Traeger Institute of Optimal Aging. So it's the Optimal Aging Institute. And I saw that the Dulworth Furniture Building was empty, and the university owned it. And I said to my boss, I said, why don't we move the whole Traeger Institute? We were in the Atria building down on Market and Floyd. I said, let's move it to that for our patients, so we could actually see patients. So we moved it. We developed a wellness area. So it has a geriatric clinic. So we have one of the largest geriatric practices in Louisville. And within the clinic, we have both the University of Louisville grant team and then University of Louisville Physicians Clinic team. So we have both the medical, we have behavioral health, and then what I'm real excited about is all of our services that we have. So we have wellness and lifestyle services, the Tai Chi, the yoga, we do drumming, which a lot of patients have found helpful, which is a lot of fun too. And We have alternative approaches to pain. So we had an acupuncturist, she's out on maternity leave right now. So we do acupuncture, chronic disease management, palliative care, falls prevention. We have an elder law clinic for those that cannot afford to go to an attorney. We have a joint program with the law school, and we have law students come over to the Traeger Institute and actually do simple will, a simple healthcare surrogate, and power of attorney. And then we have a dementia clinic and a brain health clinic, and then caregiver program, friendly visitor program. We have a lot. This is our website. So you can go on and when you hit that request for an appointment, if you fill out the form, it's a real simple form. You can see, you can make an appointment for any of these things. And a lot of them, they do charge. It's really a small sum. It's like $5 or something like, it's really low to like go to yoga. And the yoga instructors are excellent. We do a lot of research. We train about 60 students a year in behavioral health and in caregiving. So we're training the workforce, the future healthcare workforce. And let me think what else we do. We're not only in Louisville, we're in Eastern Kentucky. We have students from California, we have students from Oregon that train with us. So we're really throughout the states. The governor comes down every once in a while and he'll come to our conference. We have a once a year big conference, an optimal aging conference, where we have speakers coming from all over the country. So we're trying to approach health from a whole health perspective, because the way healthcare is given to us, you go to a provider's office, a medical doctor's office, go up to the window, you sign in, you sit down, when you walk into our office, it's a big open office, there's a lot of plants. We're just getting a baby grand piano brought into the waiting room, that's coming in this week. So we're really doing some different things, but where you can access this is, we have free parking too. It's right behind, like between, it's the old, what's the old market that was down there? Haymarket. It's the old Haymarket, where the old Haymarket was, and they built all the big buildings. It's right by the fire station between Brook and Floyd. There's the fire station in the corner. There's an alleyway, and that alleyway has a free parking lot, so all of our patients have parking. But we're trying to provide whole health. So we wanted to avoid that going to your one doctor here, another doctor here, another doctor there. So we have technology where if you have a cardiologist and they want to see you, you're at the Traeger Institute and you want to see your cardiologist, we can give you a room and you could do a Zoom meeting with the cardiologist. So that's the sort of the goal. And in behavioral health, we see a lot of patients for behavioral health. And that's growing rapidly. We just hired another licensed clinical social worker. And we have three of our behavioral health providers focus in on any type of movement disorders, and Parkinson's, all types of disorders, but they focus in because it's a challenge. I mean, getting old is not easy. This is the big challenge. Yeah. I personally, my journey is I've been going to a cardiologist since I was in my 30s, and went to the cardiologist, and they said, yeah, you're fine. And I went 35, went to 40, and they said, yeah, you're doing okay, keep doing what you're doing. Went to 50, yeah, you're fine. And I got to 60, said, something's not looking so good here. I go, wait a minute, I've been coming to you since I was 30. We're both aging at the same time. What did we miss along the way? So, your heart's not looking so good. And sure enough, got around 62, 63, they had a bunch of, it was bad, my heart was really bad. So I had to go, number one, on meds, but number two, changing lifestyle. So I totally changed my lifestyle, lost weight, changed my lifestyle, and bought into this whole health model. So you can make changes that change your life. There's never too late. I have patients that are in their 70s and 80s that decide they want to, I asked the question, how long do you want to live, to my patients, and they give me a number, and I go, let's figure out how we're going to get you there. And we do the best we can to try and get them there.
So could we make an appointment with you just to come down and?
Yeah,
you show us around?
Yeah, gladly. Yeah, anytime you feel that you want to come down, yeah, absolutely.
Yeah, and you guys will be hearing about these services and everything a lot more. We've actually been in contact with the Trigger Institute for several months now. I actually spoke at their Optimum Aging
Yes,
conference.
yes.
And so we've been back and forth. So a lot of these services will be online on the website, and then we'll put them out in the newsletter, and then also they will probably be putting a lot of our services like the Rocksteady and things like that on there. And because a lot of these of this model is kind of like what the model that we want in our headquarters in the facility. So we've been we would like to kind of do something. We've been in talks with U of L about a lot of things, but having a satellite location inside our headquarters.
That's wonderful. Yeah,
So-
yeah, I've seen the emails going back and forth.
Yeah.
And the millions of emails that go back and forth.
Yeah.
But yeah, it's really nice. Yeah, and this is I think changing our healthcare system is difficult, but we're in control of it. We've got the controls.
Yeah.
We have the controls. When something's not going right, we need to say, this is what we need. And that's what we're open to hearing. I know Fraser's right with us. They're right in our facility. So the same thing. We want to put the controls in our patients, not that we're in the control. We'll join the journey with you. But it's a different approach to healthcare, and U of L is really on board with this right now. They're really promoting it. So any questions on anything? I'd like to try a little meditation practice, if you would. Okay, all right. So we're gonna do, I'm gonna do it on here, as a matter of fact. We're gonna do a 10-minute meditation practice. We have time, we're good?
Yeah.
10 minutes, and we'll be
That's
good. All right, so we're gonna do Insight Timer, and we're gonna do 10 minutes, I'm gonna put 10 minutes on the app. And then what we're gonna do is, I'm gonna lead you through just I'll give you some prompts, but I'm gonna lead you through some quiet time. We could just follow your breath in and out, okay? For 10 minutes. All right. Okay, so we'll listen to the bell, and after the bell, if you feel comfortable to close your eyes, close your eyes. It's good if you could, lay your hands on the table or on your lap, but it's nice to solidly ground yourself as much as you can when you're doing your meditation practice. So as you begin your meditation practice, settle down, settle your mind, feel your buttocks hitting the chair, feel your back up against the chair, and let the stress of today fall to the floor. Feeling your shoulders relaxing down, your hands relaxing, your eyes closed, and just being present to this room, hearing the hum of the air conditioner, hearing my voice, knowing that at this moment, for these next couple of moments, you're safe, everything is okay. No one can hurt you. And you can experience relaxation. Begin, if you can, to notice your breath. Notice the breath coming in and out. Observe where you feel your breath. Is it on your lip? Is it just at the tip of your nose? Feel it going in and out. Focus on it for a couple of seconds. the sensations going through your body. See where your mind goes. What's it thinking? What is it hearing? And just let those thoughts go through your mind. And bring yourself back to your breath. Focus in for a minute on your shoulders. Make sure they're relaxed. In your neck. In your back as it hits the chair. Stay focused on your breath, in and out. If you need to say in and out, that's okay too. There's no right way to do this. This is just one way. Feel the sensation in your chest. Is the breath actually going in? Or is your chest tight? If it is, relax it. And your stomach. Let your breath fill your stomach so that you can feel it going in and out. And if you have to take a deep breath, that's okay, you could do that too. Focus on the breath. If your mind wanders off, just bring it back to the breath. Feel your legs very relaxed. And your calves relaxed. Be aware of your feet as they're touching the floor. And let whatever stress you have in you go right after your toes, right into the floor, into the ground. Visualize your body being relaxed. Every once in a while, check in with the breath. In and out. In and out. Feeling your feet once again. Go back up to the calves. Focusing on the calves. Focusing on your upper thighs. Letting them be relaxed. See if you could relax them just a little more. And your buttocks touching the seat. See if it can relax just a little more. shoulders. Spend some time here. Just let your shoulders relax even more. Go deeper. Feel that relaxation going through your whole body. Knowing that this is your moment. Feel your neck. See if there's any leftover stress in your neck. Going up to your ears and your head, the top of your head. See if you can see a white light shining down all through your body. A white light of relaxation. It takes away any stress that you had from the day. Just focus on your breath again. Breathe in whatever stress you may have left over. And breathe out. Breathe it all out. Every time you breathe out, you're letting go of something else. Just slowly, whatever feels comfortable, open your eyes and come back to the room. What was your experience? So, 10 minutes didn't take very long, did it?
No.
You think about a whole day, we spent a whole day in just 10 minutes. That's not that long. Yeah, trying to get people at work to do this is one of my big tasks, because even taking a break for 10 minutes is difficult for everybody. But if you have the opportunity in the bigger scheme of your lives, wherever you are now, begin to practice. Begin to practice this on a daily basis. If it's 10 minutes in the morning and 10 minutes at night or 10 minutes in the afternoon, it doesn't matter. I do it between meetings. I'll do my 10 minutes. I had 15 minutes on it because I did it yesterday. I'll do 15 minutes of mindfulness meditation just to get that relaxation. There's so many studies on what stress does to our bodies. I mean, it's the cause of death. It should be on our death certificate. That'll be mine. Cause of death, stress. Because that's what I spent all my years. Stress, under stress. So try and take this time. Health gives us what it gives us. So let it be our greatest teacher. And how do we take what we have and let it be our greatest teacher, rather than fighting it? It's a hard thing to do for all of us. Do you all have any questions? I hope this was helpful to you.
And if you guys have trouble falling asleep, a lot of people have trouble falling asleep.
Oh,
You
yeah.
lay in bed and you just do this.
Yeah, sure, yes.
So what about payment? Insurance, the doctors, are they in like the U of L network or?
And Trader? Yeah, they're in the U of L. But they take any insurance, like Frazier and us, it doesn't matter. Yeah.
Medicaid?
They take Medicaid, yeah, we have a large Medicaid population.
Okay.
Yeah, I think that was the last question. So this is my contact information, so that you can contact me. But yeah, and if ever you have problems like getting us or anything, just ask for Dr. Joe and they'll track me down. So they call me Dr. Joe because my last name's so long. Difficult, easy to just say Dr. Joe. But I know Frazier, I know for sure Frazier feels like us. We want to be with you on the journey, on the health journey. Not to be alone. We shouldn't be doing this stuff on our own. This is too difficult. And the way our system's set up, going from one doctor to another doctor to another doctor to another doctor, it's like, I have some of my patients I see for behavioral health, they have 21 medicines and they're seeing 7 different doctors, and the doctors don't talk to each other. So we're able, one of the things we do is with our students, we have healthcare navigators, and we train our students to be healthcare navigators. So when patients have too many doctors, we assign a student, and then the student navigates. That's what we're teaching them. We have community health workers. We have a whole community health worker program where we're training with the state. So it's getting that system set up so that it helps us age. And our goal is to age in place, not to end up in a nursing home. Only 2 to 4% of people end up in nursing homes. Everybody thinks it's much higher, but it's not. It's only 2 to 4% of people are in nursing homes across the United States.
The average stay is, you know what the average stay is?
Oh,
Like
I
3
knew
years
that.
or so.
Say that again?
3 years.
Yeah, I was gonna say 2 years, but yeah, it's somewhere around 2 to 3 years. Yeah. But that's only 2% of the population, it's 2 to 4%, so the rest of the population is 96% is living at home. And that's our goal, is how do you live at home and age? And we're creating a workforce at Traeger to be able to help us accomplish that.
Yeah, and one of the things that, the discussion with Traeger is, whether it's insurance or anything else, because everything that we usually try to offer is free of cost, is that, we have been looking at, if even the cost or insurance or anything else that, we could, we're trying to work out something where we can cover, any of the
Exactly.
cost for any of our group that's in,
That's correct.
that's in our Parkinson's.
Yeah.
So,
Yeah, all of our activities, like I said, there's a real small payment, but if someone can't pay, we'll figure a way to get around it. I'm always figuring a way to get around it. Because I have some people that can't pay for behavioral health, that have Medicare, and they have a $40 copay, and they can't afford the $40 copay. And we figure a way to get around that, because we have students, our students don't charge, they're all for free. So we have free therapy, that those 40 students all need training, and they all need 7 to 10 hours a week. So we have a lot of ability to provide services, care coordination, or as I said, even friendly visitor program, that we have people with social isolation that just want a visitor every so often.
We've been excited to announce this and roll it, let everybody know about this, because it's still a hidden.
It's a
Yeah.
hidden, it is, yeah. It's funny, we do marketing, but it does the message, some reason we can't get it out. That's what we're working on now with the president of the university, because the new president's really excited about the Traeger Institute and really promoting it, to be able to get it out to the public.
We need to go to this, you have all these different, types of doctors. Is there one that kind of puts it all together?
So this is, I'll tell you an interesting story. I'll tell you the truth, where we want to get and where we are. So it's still difficult, because the cardiologists a lot of times want you to come to their office. They don't want to do telehealth. So we're pushing to be able to do that. And it's a system change. It's a big healthcare system change. This is something that nobody has in Louisville right now. It's not in this area. It's not in our state. But our geriatricians are sort of like the ringleaders. They're the ones that ringlead everybody else in. But it's even training them to have a whole health model. So the VA, the Veterans Administration, really was the one that has promoted the whole health model. And we've just taken it and said, let's run with it. So it's difficult. And you may come in and work with it. You may come in and work with one of our providers and have a cardiologist who doesn't want to do it. And then we'll work with them. That's our goal. Our goal is really with training people on interdisciplinary care. One of our big projects for this year is we have a culinary medicine kitchen. So the University of Louisville School of Medicine still does not have culinary medicine in their curriculum. So we built out a whole kitchen, which is really, really nice. We have, 8 spots. GE donated, stoves and refrigerators, and we have 8 cooking stations. So we're gonna be teaching cooking lessons. Hopefully in the fall, we'll get that started. It's a beautiful facility too. And as a, I mentioned the baby grand piano. Someone donated a baby grand piano to us, and the system said, you can't have that in the waiting room. And we're like, my boss and I are like, why not? What a great place for it. No, we'll put it downstairs in the lower level in the training room. I said, no, we put it right in the middle of the waiting room. So when people come in, we have a lot of older adults that play the piano that would love to come in and spend an hour just playing the piano. So things like that, but it's systemic changes. It's the healthcare system itself is so fragmented and so separated. So we're trying to really address that and change that. So yeah, come down for a tour anytime. When I'll start cooking in hopefully the fall.
Awesome.
So we're gonna focus on all cooking, but more of a plant-based diet, because we're finding that keeping people on more of a plant-based diet reduces a lot of the mental health stress that we're experiencing.
Who's the director?
Anna Fall, she was one of the associate deans at the Kent School of Social Work. And then Christian Furman is our medical director. Pam Yankee Love is our director of research, and Barbara Gordon, who is the head of area agency on aging at KIPTA. She's our community director of community affairs. So yeah, but we work closely with the school. We're in the School of Medicine, so I'm like a faculty in the School of Medicine, and really trying to promote something different.
Thank you so much.
Yes.
Thank you too, I appreciate it. Yeah, thanks for what you shared, I appreciate it. And feel free to call if you have any questions.